I'm Ariel Azor, host of Right This Way, and today we're going to talk about COVID mandates. So I've talked about this a couple times so far. We've talked about how far are we going to allow the government to push? Is this actually necessary? Are there any facts to prove that all of these testings and mandates, guidelines they've placed on us, is there any factual evidence to prove that any of this is actually helpful? Is there any evidence, even if there's nothing to prove that it isn't helpful, is there any evidence to prove that it isn't helpful, that it actually can cause worse problems, and all of these things, and we'll get into all of that. So we're going to start with sort of just mentioning what some of these guidelines are. Obviously, everybody who lives in America knows what these are. For anybody who doesn't, we've got basically, especially in my state, which is Pennsylvania, we've got masks everywhere. The second you step into a building, you have to wear a mask. Even on college campuses, they're actually requiring you wear your mask outside, like literally at all times. The only place you're allowed to take it off is in your dorm. There are other countries, I believe it's Sweden, that they literally never had any mask mandate because they said, all of our doctors, everybody says there's no proof that it helps. We've looked at the size of a COVID-19 particle, and you can see that the particle itself is smaller than what the mask will protect you from. So the mask will, the mask, whatever area that covers your face, it allows a certain size particle to get through, obviously, or else you wouldn't be able to breathe through it if it was like literally airtight, right? Makes sense. So they're saying that the COVID-19 particle is so small that it supposedly goes right through these masks, but there's no proof that this actually stops COVID-19 from spreading. Now, they tell you it does. I'm sure you've seen on the news that you've got to wear it because masks help protect other people from you. That's what they're saying. But when you actually go and you actually look at other sources, not just the news, the mainstream media, when you actually go and look for other sources, there's no proof of that whatsoever. And like I said, other countries, they didn't do a mask mandate because they had no proof that it worked. So let's talk about, people like to say, well, even if there's no proof that it works, on the chance that it does work, we should just wear them because it's so selfish of us not to. No. Here's the problem with that. Of course, I want to be a nice person like most other normal people. And if I can do something that is a slight inconvenience or annoyance to me, but it saves someone's life, of course I'm going to do it, right? Of course I'm going to do it. But we have to talk about the other consequences. It isn't just as simple as, if I wear this, maybe some old person won't get COVID. Like, it's not that. It's not that at all. There's so many different issues. One, we'll start with people that have disabilities or pre-existing health issues that for whatever reason cannot wear a mask. And I've seen a couple stories on this already, is that somebody that does have a disability and they have medical proof that they have a disability, but like, you don't just get like a card, you don't get a card that says I can't wear a face mask. They go into stores anyway, and because of the Americans with Disabilities Act, you cannot legally ask them what their disability is. You can't ask them about it, and you can't treat them differently or refuse them service because of it. And so I saw this one story where this man went into Whole Foods and he was shopping, and he has an actual disability. He cannot wear a face mask. It would be harmful to his health. And so he was in the store shopping around, and he said, I was like trying to keep my 6 feet distance from everybody, trying to be respectful of their rules that I can follow. And basically what happened was a store employee started like sort of harassing him, called the police on him. The police had to come. And he was polite with the police officers, obviously, because he's a normal, good person. And he just left the store with them, and he talked to them, and he said, look, this is my side of the story. I didn't do anything. When he asked me to leave, I left. But, like, it's not even legal for him to do that to me. And, yeah, end of story. I mean, that was basically what happened. And so we're seeing instances like this, and we're seeing instances where the people don't, like, this man obviously was treated relatively nicely. I mean, he still got the police called on him. That's kind of a big deal. But we're seeing people being treated very rudely, very disrespectfully for not wearing a face mask. And it's kind of crazy to me because it's this like groupthink conformity where this person doesn't have a face mask, I'm going to give them a dirty look, or I'm going to, kick them out of my store just because I can. It's just ridiculous that we've allowed people to become the mask police. that everybody who works in a restaurant or a store or whatever can just say to you, nope, you can't be here. Bye. You have to leave. Like, I'm going to call the cops on you. I mean, that's not what happened to me, but that is what's happening. It's not just people saying I'll call them on you even. It's people actually calling the police because someone isn't wearing a face mask. But you don't know why they're not wearing that. And again, we go back to, does it actually help? Is it actually harmful? And there's so much more proof. This is the crazy thing. There's so much more proof that this can be harmful to your health than helpful, because no one's talking about that. No one's looking at it. No one cares at this moment in time. What we care about is, do you have a mask on? Are you 6 feet apart? Are you following all of these rules that the government told us to follow? And you have to follow them. And if you don't follow them, you're a bad person and you want people to die. That's pretty serious. I don't want people to die. I don't want people thinking that I want people to die. That's insane. Why would I want that? I mean, I'm like every single regular person. It's just crazy that, again, you think they're a bad person because they don't want to cover their face. But but people that are going to work and kids that are going to school, like in person, having to wear these masks, people are getting bacterial infections because they have a mask covering their face. It's kind of nasty and like damp and stuff after it's been on your face for a while, because like you're breathing out. These aren't meant to be worn for hours and hours and hours every single day. It's just not meant to happen. But the news isn't really reporting on this. They don't really want to talk about it. All the doctors before school started a couple months ago were saying, yep, we'd send our kids back because they're not dying of COVID. They're not spreading COVID. And they really need to go to school. That's kind of important for young people. So although we have seen doctors saying those sort of things, I don't think that had any effect on them letting them go back to school. I think they just said, as long as you comply, as long as you do what everyone else is doing, cover your face, wear this thing, you're going back. And people wanted to go back. So I think that they're doing it. I think there's honestly danger in doing something that we do not know the consequences of. It's like when people started smoking and cigarettes first came out, they didn't tell you they were bad for you. They actually said there's all kinds of health benefits. It's really going to be good for you. And then people were able to do some long-term research. We've never done any long-term research on wearing masks for long periods of time because we never had to. There's never been any reason that in the United States of America, you would be forced to walk around covering your face with a useless piece of cloth. There's never been any reason for that. So we haven't done any studies. But again, with the cigarettes thing, it's the same thing. At the end of the day, we just don't know what this is going to do to people's health. We have, seen cases of people, like I said, bacterial infections and different things caused by the masks, or problems breathing, different things caused by the mask. But there's no proof that wearing it actually prevents one person who is sick with coronavirus from transferring it to another person who doesn't yet have coronavirus. And I mean, that's not even to mention how inaccurate the tests are, right? We say everyone has to wear a mask because you might have it. Listen, I'm not sick. And everybody else who's not sick, there's so many people. Every single person that has gone to college now that I know of or know personally, or have heard about from my friends, that has tested positive for COVID has no symptoms whatsoever. And you know why? Because they aren't sick, because they don't have COVID. The tests are incredibly inaccurate. And again, we're not seeing this reported in the news. You see maybe one story that pops up on your Instagram because you follow some good news accounts or something like that. But it's not being reported in the news because they don't want to admit how fake it is. Of course it's real. I know that. I know COVID is real, and it's terrible that people are still dying, and it's terrible that, even young people are, unfortunately, there have definitely been cases where young people have gotten the virus and have died from it, but all of them had underlying causes. They all had something else wrong with their body or something else in their system that was going on at that time that ultimately, compiled with coronavirus, led to their death. I'm not saying it's not deadly. Of course it's deadly. Of course it's real. But it shouldn't mean that healthy people can no longer walk around and interact with other healthy people. Listen, if you're sick, if you have a fever, if you have any symptoms of COVID-19, stay home. Every normal human being will say, oh yeah, I'm sick. I shouldn't spread this to other people because it is deadly. But if you're not sick, you don't have it. You're not sick. Like, this is what people aren't understanding. Just because the test tells you it's positive. Do you have any idea how many tests say that they're positive when they aren't? There are at least 2 different types of tests you can take, viral or antibody. One of them says that you actually currently have it. I believe that's viral. And then I think the antibody one tells you whether you've ever had it. So the CDC admitted that they combined these test results. They're 2 completely different things. They combined test results of people who have had COVID-19 at some point with people who currently have it. So their numbers, when they say this is how many people have COVID in Pennsylvania, their numbers are completely false because that's how many people have go and get the test and have ever had it. Like, even if they don't currently have it, those numbers could be 10 times what the actual numbers are. We won't know because it's the CDC doing this, and we all trust the CDC, right? These tests all around are notoriously inaccurate. That's just one example. They admitted to doing this kind of on the down low. They didn't want people to hear about it, but it still somewhat made the news because that's a super big deal that they're literally reporting completely false numbers. We've seen several testing facilities that have had 100% or 90% plus positive test results. We know for a fact, statistically, that's completely impossible and that these numbers cannot be true. And then they sort of admitted, oh yeah, we must have an issue with the testing there. That must be what that was, just an issue. It's really convenient that so many places, I mean, Florida especially was one of the ones, there were several testing facilities, and Florida was one place with really high case numbers at one point. And I mean, it just goes to show why they're not even fairly or honestly representing the actual number of cases. Because if they did, people wouldn't be so worried. If they did represent them fairly and honestly, people would understand, oh, it's okay. It's still dangerous for people who have health problems or, this and that, but it's going to be okay. We don't need these face masks. And I think people would start thinking that way. And I think that's their problem is they don't want people thinking about that. We've seen issues, again, we'll go back to colleges, all of these crazy things we're doing. My brother goes to Baylor University. They sent out an email that they quarantined an entire residence hall because they were doing sewage monitoring of these residence halls, and they identified traces of the virus in a specific hall. So they decided to quarantine all of the students based on a sample of sewage coming from the dorm. To me, again, it's kind of saying, how far do we allow this to go? Maybe when you sign up to go live on campus somewhere, you're totally cool with them testing sewage that comes out of your dorm room. I think that's super weird. I think that's super invasive. And here's the thing is, when you take a COVID test, you're pretty much agreeing to go take it. Now, a lot of schools have forced students to take it, and that's not really agreement, but like by saying, yes, I'm going to go to the school, you are agreeing to the terms. So I get that. But schools doing this sort of thing, I'm just concerned that nobody cares. Nobody is saying, hold up, I didn't sign up for this. Did you say when I was signing up to come to this school for this semester, did you say you were going to test me without my knowledge? Did you say that? Because again, they didn't know that these students were sick. They didn't hear about a student being sick, going to get a test and testing positive and think we have to quarantine the whole hall. They literally tested the sewage and found traces. So again, we don't know what that means. We don't know how true this is, but it could be the antibodies test where it literally just means someone's had it. So did they quarantine a bunch of students who were completely healthy? Probably. Is someone going to say something about it anytime soon? Unfortunately, no. But if we continue to let them push us this far, and again, this is college, you did sign up to go there, and when you walk into a store and put a face mask on or don't, you did walk into that store. You don't have to go in there. No one's forcing you. And I think that's why they're allowed to push so many rules. But even the governor pushing these rules on businesses and making these mandates, if we continue to comply with them, they're not going away anytime soon. That's the problem. If you continue to comply with something that doesn't affect them, right? Because we've talked about this before. Celebrities, governors, all of these politicians in DC And in your home states, even, like I said, governors and health directors and all of these people, these rules do not apply to them. They have shown us that time and time again. We've seen them without their masks over and over and over again. And they say, oh, I don't have to wear it here because whatever. And it's just as stupid as when they tell us we don't have to wear our masks sitting at our table because COVID knows we're eating. It knows we're eating, and it does not attack while you're eating. It's very kind, actually, not to attack us while we're eating. But it attacks you the moment you stand up from your chair. So you do have to have it on to walk out of the restaurant. This is the kind of thing we're dealing with, and this is the kind of thing we're not just dealing with, we're just completely accepting. We're being super, super complacent about this. And I'm not saying let's go riot about face masks or let's go start a civil war over face masks. But the moment we stop wearing them is the moment they don't have any idea how to force us to. Because they aren't forcing us to. They can't. They can't actually mandate this and enforce it. They can mandate it and say, here, you have to do it. And we all do it. But the second we stop doing it, there's no enforcement whatsoever because they can't enforce it. If you've enjoyed this episode, you can give me a thumbs up on YouTube. You can leave a review on Apple Podcasts. And you can also check out my Instagram at right.this.way.